Yes, people, welcome aboard. Welcome to the platform. It's a good day today, and every day is a good day as we talk, as we discuss issues concerning everything, every person. Every day is a good day. Now, we have a topic today. We have talked about very many topics, and today we're going to talk about a very important topic that people talks about every time. Very important one called dementia. Dementia. We should understand what is dementia and also get to know the types of dementia, how dementia comes. We define what is dementia. We try and learn about dementia. You see, we see because some people always say, Uncle, Jamaican uncle, welcome to the platform. Welcome, welcome. Welcome to the platform. Today we're going to talk about dementia. Hmm? That, Dementia. Let's discuss and see and get to know what is dementia. People always go to the hospital after, you see, people that are diagnosed with dementia, they will not have one visit to the hospital. Hmm? They will have several visits, and then you come and be told your diagnosis is dementia, and then you are confused. Hmm? Some people even don't know the main reason of dementia. Hmm? Uh, Now, we have a great topic to understand, and there are some several types of dementia. We have around 9 types of dementia. We're gonna look one by one, and even if we will not manage to look at management, yes, Margie, welcome to the platform, Margie. Yes, yes, yes. Very important, Margie. Good, welcome. Thanks for your support and subscriptions, and we are continuing to grow. Thanks very much. So, when a person is diagnosed with dementia, what do you understand by the name dementia? You personally, when you are told, mostly it affects older generations. So, what do you understand by what is dementia? You see, you should know what dementia is. And this is it. Dementia is a chronic progressive syndrome characterized by decline in cognitive function, such as memory. You see, cognitive function. When we talk about cognitive function, we are talking about memory, memory, reasoning, language, and judgment. Because there are some things that you may do that may impair your judgment. You see, when you want to do something, you are confused on what to do. Let me say you are warming yourself around a fire station. You want to remove some charcoal so that you light another fire, but you end up putting your fingers in. You see, those are judgment issues. Or you want to cross the road. You have a problem on the judgment whether to cross or not, because the road maybe is the car is coming, the road is wide, and your judgment is impaired. So those are types of dementia, guys. So I'll repeat again. Dementia is a chronic or progressive syndrome. When we talk about syndrome, we are not talking about an acute disease. We are talking about something that comes chronically and it is for a long time. Syndrome characterized by decline in cognitive function. When we talk about cognitive function, what do we understand by cognitive function, my friends? Cognitive function. Please, yes, Jean. Hey, welcome to the platform, Jean. We're talking about dementia today. Please like the video and share to other people. The information may be vital to someone else. Now, when we are talking about cognitive function, listen to this so well. We are talking about memory, reasoning, language, the kind of language that we are using, and judgment that is severe enough to interfere with personal daily life and independence. Just imagine when you've gone to the supermarket, or you've gone to buy something in the shops, or gone to pick something, and then you forget to go back home. You start asking the people around, like, people, I have to go back home, but I forgot where I came from. You see, people will start saying this guy has gone nuts. Hmm? It's Ale in the platform. Welcome. Bless up, watching from Florida, checking in the Jamaican's uncle, Jamaican uncle, my friend. Big up Jamaican uncle always. We are talking about, it's Ale, we are talking about dementia, discussing about dementia. And I'm giving an example of cognitive function, like you're just going to buy something in the shops, and then you forget. Coming back home, you forget where your home is. These are features of dementia. You see, these are features of dementia. There are some features of dementia that are very funny, like language. You forget the language that you use to do some things. Your reasoning capacity goes down, and of course dementia has memory issues. You see, but key features in dementia here we will see. One is impaired memory. Your memory is impaired. You cannot remember something else. But when you go back to the videos, we talked about the frontal part of the brain, remember, which carries the cognitive function. And the main neurotransmitter here is called serotonin. We'll look at that. Now, the key features in dementia, when you suspect, or you are looking at a person and you're like, this can be dementia, what are you looking at? This is what you should be looking at. Impaired memory, difficult with communication or language. Sometimes there are some people who have difficulty in communicating, trouble with focusing, reasoning, and problem solving issues. You are not able to solve common problem issues, like fixing the normal things at home, being clean, fixing a kettle when a kettle top, it's a problem. And sometimes you may find changes in behavior, mood, and personality. A person just changes his or her personality, and mood. And you remember we talked about mood disorder. So these are key features, but we will see how and when to suspect dementia, to differentiate it from mood disorders and psychotic issues. Loss of ability to perform daily activity. Now, dementia is an umbrella term. It's an umbrella term under big other issues. So dementia is not just one. We will see how many. I've said we have like 9 types of dementia. Now, I repeat slowly by slowly the definition of dementia. Dementia is a chronic and progressive syndrome characterized by decline in function beyond what might be expected from normal aging. As you age, you start having funny issues. It affects thinking, memory issues, orientation, comprehension, calculation, learning capacity, language. You see all of that. Language, consciousness is not impaired. You are always conscious. Dementia significantly interferes with the person's daily activity, independent and social, occupational issues. You see, this is a very important topic to the old age. So here we will see several types of dementia. The types of dementia that we are looking at right now are: one, Alzheimer's disease, mhm, Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, mixed dementia, Parkinson's dementia. You see, we know about Parkinson's disease. So here we have Parkinson's disease dementia, Huntington's disease dementia. You see, dementia is one term that is an umbrella of many. Creutzfeldt, uh Creutzfeldt disease, Jacob's disease, and we have normal pressure hydrocephalus, alcohol-related dementia. That is called Karoskov syndrome. Karoskov syndrome. You see, so we discuss these issues one by one, and if anyone has a question, it's important to put it through so that we understand. We have said dementia is not just dementia. We have several types of dementia, and I've said the nine. So we start with Alzheimer's disease. Have you ever seen someone being diagnosed with Alzheimer's disease? Alzheimer's disease. What do we mean when we look at this and we say this is Alzheimer's disease? Hmm? Under the umbrella called dementia. When do we say this? Alzheimer's disease is the most common type of dementia. This is the most common type of dementia. It goes up to 80% of the cases of dementia. Hmm? It is a progressive neurodegenerative disorder. When we talk about neuro, we are talking about the brain disorder. You see, Alzheimer's disease, it's a that graduates gradually. So, it is forgetting where you put your car key one type. Maje, you see, there are sometimes this is features, and we are still learning. We will see how features come in. But you see, you can be thinking about very many things. You are stressed, you have done, you are so tired, and then you forget a car key. That one episode of forgetting a car key, Maje, it's not the feature of dementia. You see, you will come and remember where you put your car keys. We will see how to categorize dementia and features of dementia. Now, we have said, Maji, dementia is a word, but under dementia, there are the nine that I've named. So we will see how these problems come out, and you will understand. I understand you so well, and I understand your question. There is normal forgetting because of multitasking, but there is this dementia. Now, we have said dementia is a chronic progressive syndrome characterized by decline in cognitive functions. Like what? Memory, thinking, orientation, comprehension, calculation. There are so many. The normal cognitive. Wagwan, Michael N. Big up Michael N in the platform. We are talking about dementia. And I've seen Maje asking if forgetting where you put your car key. That's why I'm explaining. Just listen, you will know what is dementia and normal forgetful things. Yes, we go on and say we are in dementia, and we are discussing Alzheimer's, the first part of dementia. Please like the video and share. It may help someone. Very important. Now, Alzheimer's disease is the most type of dementia. It's the most type of dementia, and uh, of all cases, it is a progressive neurodegenerative disorder of the brain. It's neuro, the brain. Every time I talk of neuro, think about the brain, okay? And it destroys memory, thinking skills, memory. So the nerves and the neurotransmitters of the brain are destroyed, and you have this problem now: memory, thinking skills, and eventually the ability to carry out even a simple. This is now Alzheimer's. It's a degenerative problem that destroys the brain. And the key features, when you look at someone and you say now this person should be having Alzheimer's, one of the parts of dementia, what do you look at? You look at memory loss, especially recent events. And you see, it will not just be one memory loss, several, forgetting everything. Some people even forget their children. And you see, these are diseases of old age. So you go and visit your parent and asks you, and who are you? And but after some time, you may look at your parent or your the old parent you have, and that parent looks at you every time. Loading, who is this? Disorientation, time, place, and identity confusion. You don't know the time, place you are, and sometimes when you are asked who are you, you cannot answer because you forget the normal things that you should be knowing. You forget language difficulty. Sometimes you even putting out a word becomes a problem because you don't have the cognitive function in your brain. Poor judgment and decision making. Sometimes you can't make a decision. I've just given an example of crossing a road. You don't know when to cross the road because a car is coming. You have to cross to the other side, but your judgment is poor. You can end up getting a knock. You see that? Yeah. Personality and behavior changes. You start having funny behaviors. Remember, when the frontal lobe of your brain is has a disease or is atrophying is being small, it means it is being degenerated, the brain. So you start having problems with forgetting, sometimes issues concerning pleasure you don't want, your behavior starts changing, mood swings, because now the main, yes, Cherono, welcome to the platform, Cherono Kemi. We are discussing about dementia. So if you have a problem or a question, just ask Cherono and the others always. If you are not understanding anything, come up, I explain. Inability to perform daily activities like, hey, good morning, watching from New York. Com- Compliments of the. This is the great topic. Yes, welcome to the platform, courtesy of Jamaican Uncle. We see you. We are discussing about dementia. Welcome. Inability to perform daily tasks. Now, causes. What can cause you to have Alzheimer's disease? What can cause you to have Alzheimer's disease? This is the causes. Accumulation of abnormal protein in the brain. You see, your body is made up of proteins. Hmm? Your body is made up of several proteins, and there can be a protein that can just start accumulating. That is not helping you to do the normal work that you should be doing. You see, hmm? The normal work. This is very important. There's when you've had a term like amyloidosis, those are protein that mutate, yeah, and they start forming funny things that are in your brain, funny functions in your brain. You see, and then yesterday someone laughed when I say some people start saying that that one has a problem. The juju has come in, or the villagers start saying in Africa they say someone has bewitched you. It is not bewitching someone, or someone has gone to the witches so that he can turn around the wheel, or a sangoma has visited. No, maybe you have the beta amyloid protein plague outside the nerves of of your brain. So the beta amyloid plaque is a protein that grows in the brain. When it goes in the brain, it stops the normal function. Even neurotransmitters are reduced. So you start having funny behaviors. Hmm? And then there is something called tau protein inside the cells. You are born with cells that when you grow old, they start functioning abnormally. neurofibrillary, it is called neurofibrillary tangles, tau protein. These are the problems that come in dementia. You will see that some family members have this problem when they grow old. It's because their genetic function or their genetics, they have, they are prone to having this beta amyloid plaque or neurofibrillary tangles. You see, so this is the main cause of Alzheimer's, the main type of dementia that we have. And there is another one, which is a cause, which is loss of connection between nerves and cells. Because nerves are like my hand, like this. You see, this is a nerve. Let me say this hand is a nerve that have ends. These are the ends. And then there is this one. This one is another nerve. So when this one is another nerve, when you release neurotransmitters here, it is taken to this one. And then it goes to the brain. You see? So if there is no connection between this nerve and this nerve, because this is a nerve, when I prick here, let me say I'm pricking here, the impulse goes up to this. They are called the dendrites. And then what do the dendrites do? The dendrites, they release a neurotransmitter which goes here, like it is called like acetylcholine, which goes here. And then it goes to the brain and it tells your brain something is happening. Please withdraw your hand, you will burn. That is how nerves work. But if there is no connection, maybe the neurotransmitter is not working or something, what happens? You start having Alzheimer's because you will forget. You will not have that cognitive function. And then there is when you grow old, the third one, when you are growing old, some of families, their brains become small. So a small brain will have a low capacity of storing information. And that's where you come and start having problems of thinking and remembering. So we in Alzheimer's disease, yeah, those are the main problems that come in Alzheimer's disease. Causes of Alzheimer's disease, which is a type of dementia: accumulation of abnormal protein in the brain, I've explained; loss of connection between nerve and cell, I've at least tried to explain using my hands and how nerves work; shrinking of the brain when you are going old. You start forgetting your brain, and then they do a brain MRI, they see it is going to be small. That's how you start being forgetful. We should take foods that are helping your brain cells and your brain capacity to remain healthy. Yes, and you stop smoking, because smoking brings star in your body, and you know it's one of the causes that makes your brain atrophy. Atrophy, I mean becoming small. Now, we have risk factors. Those people that are at risk: age, because we always talk about age. When someone grows old, he gets this problem or she gets this. Most common in 65 years of age and above. Hmm? Family history. There is a gene called APOE that accumulates this bad property. They come up with these bad proteins. You can age host genetic test. Cherono, don't worry about it. Don't. When you're catching up with age, we will know how healthy as we finish for you to live well and be strong. There are some people who are strong even up to old age. You have seen the likes of the legends, the Sylvester Stallone, the one we called Rambo, Arnold Schwarzenegger. They are still strong. Their brain are functioning well, and they are above 65 years of age, living healthy. Now, I'm still telling you about the risk factors, those things that may put you prone to Alzheimer's disease. Head trauma, accidents, those people that fight, boxing, you have seen them when they get to 40s, they start having these problems because their head has received punches, always getting inflammation inside. And you know, inflammation is a tendency to help your brain or your tissues not to be destroyed. So when you are trying to help and it's not getting help, what do? It starts forming bad proteins inside. Mechanism of defense of your brain, boxers. So boxing is good as a sport, but it's very important to check how we are doing that sport. Sedentary lifestyle. Yes, that is where I hit a little bit hard. Always driving, always taking foods that are, yes, no, always taking foods that are deep fried. And I usually say foods that are deep fried, my friends, foods that are deep fried like chips, chicken, KFC, my friend. You know, they are sweet, so sweet because of the cholesterol and that is in there, and the starch that is. But progressive eating of foods that are deep fried comes out with one thing: free atoms. Free atoms, they are the main cause of producing this that we call cancers, mutations. Cancer is just a mutation of your cell performing a different thing than that is supposed to be to be producing the effect. So when your cell lives more than 120 days and it has mutated, if it is the skin cell, it will start doing something that is not supposed to do. Because, yes, Marcia Thompson, my friend, today we are talking about dementia. Okay, it's good morning from your other. Yes, yes, welcome to the platform. Welcome to the platform. Yes. Now, if it stays for more than that time, what happened? Maybe it will start bleeding because it has overtaken its work or days of working as a skin cell. Now it's doing something else. And if it continues to do that, it may spread a cancer that is called malignant. But if it is a cancer that is there, it's called benign. Now, we are talking about Alzheimer's disease, a form of dementia. Age above 65, family history of that gene. So if you have a family history of Alzheimer's disease, you should go to a doctor, do get if you have this gene, know its levels, start managing it. Cardiovascular diseases is a very important thing because if you have a heart problem, your brain will not get enough oxygen. So your brain needs oxygen and nutrients. Your heart is a pump that pushes blood to go up to the brain to push and give oxygen and nutrients. So if it doesn't get, what happens? It starts having low nutritional value. Your brain eats from the blood. You get it? Your brain eats from the blood that is pumped, giving oxygen for the processes. So if it is not getting that nutrient, what happens? It atrophies. The brain cells die. So if they die, your brain start losing its function and genius gets in. Then you start forgetting, doing normal things in a village, in the house, in a where, going around alone becomes a problem. But now, how does sedentary lifestyle come in? When you have this gene called APOE, sedentary lifestyle, you start having atherosclerosis, sediments of fats in your veins. You are eating, I've just talked about free radicals from deep fried foods. You see, the main form of cancer. So if you have free radicals and you're eating, you're eating more starch, producing more cholesterol, having sediments in your arteries, and what happens? You reduce the capacity of your brain getting nutrients and oxygen, and per se, you give your body wrong cholesterols. There are several types of cholesterols: triglycerides, high density lipoprotein, low density lipoprotein, total cholesterol. When you go and do a lipid profile, those are the four. So the bad cholesterol, which is low density lipoprotein, which is responsible for atherosclerosis, will tend to give you mutations that may injure your brain. Hmm? So as you live a sedentary lifestyle, not working, always driving, going to work, eating 4 times a day, a lot of starch, deep fried foods, getting free radicals to your body, and your cells of your body getting mutations. Think about your brain. Exercise is very important. Exercise is very important. Hmm? Exercise is very important. Please, guys, let's exercise as we grow old. Let's walk. Let's hit the gym. Let's do running a bit. Hmm? Let's work. Even if you in your house you have workers, help them at times when you are free. When you come home so late, hmm? Hit the treadmill like some time before you take a bath. You relax, visit a dance school. eh? It relieves your thoughts and your worries. You get it? Now, we are talking about Alzheimer's disease. If you have a question, let's go continue. I see Cherono had asked about age host genetic 10 are very important, and I talked to the other one, Marje, our friend, is forgetting where to put your car keys one time. We are going to see normal, forgetfulness, and these conditions. Now we have stages of this, the stages of Alzheimer's disease. Now, early stage, your forgetfulness, misplacing items, eh? Word finding difficult. You get it? You forgetfulness, and sometimes you misplace items, and word finding is difficult. You want to communicate, but you cannot get the correct word to put out. You get it? Hmm? You can't, you don't. Please, let's like the video as we go on, please, and share. And if you have not subscribed, it's important to do so. So we continue, so that you see, when you subscribe, when I'm online, you can know, so that you can come and ask your question. It automatically tells you Benjamin the Wise Guy is online. You get it? It's very important. Hmm? Yes. Moderate. We are at the moderate mild stage. Confusion. Trouble recognizing people. You see, the first one was you forget, your forgetfulness, you are forgetting everything. The second one, in first stage, is misplacing items. Word finding is difficult. You start yeah, struggling to find a word, like please move out of the way, I want to pass. You don't, you're trying to find move out of the way, but you're not finding it. You end up telling someone. First stage of Alzheimer's disease at progressive age. And then there is moderate, mild stage. The second stage is confusion. Sometimes you can't recognize people. You look at a person, but you can't remember even the name of that person. Wondering. You are just there. You are left wondering. You are left wondering. You are in town. You losing yourself in town. You are wandering around, you don't know where to go. If you find someone wandering around one place and this person is an old age, know this person has a problem. Don't say this person is nuts. This person may be suffering from Alzheimer's. You've met one day a person in town, an old person wandering around. He's going this way, then coming this way, then going that way and coming this way. This person has a problem with cognitive function of the brain. That's why he's wandering around. So he doesn't know where to go. Behavioral changes. Wandering around is one of the behavioral changes, my friends. Severe late stage of Alzheimer's, you will lose your how ability to communicate. Hmm? You can't recognize your loved ones. Hmm? complete dependence to other people. You see, but you see how when you go to a hospital, how do they find out what is happening? They'll ask you questions like someone, of course, someone will take you to hospital. So the person, if it is late stage, the person will be asked, in your family, do you have someone who suffered from the same condition of any condition of dementia? Yes. The doctor will know there is a gene of this in the family. Then there is something that we do on cognitive testing, asking some questions and ticking some charts. And then we can look at your brain, put you on an MRI machine, CT scan or PET scan to look at if Johnny be good, Johnny be good tonight. Yes, greetings everyone and watching. Johnny is in the house. Johnny, we are talking about dementia. Good, good, Johnny. Yes, you see, when you are in a CT scan or an MRI machine, when I look at that MRI, I'm able to see if your brain has atrophy. Atrophy is small, hypertrophy is being big, or if your brain has a tumor that is growing out, pressuring some pressuring some muscles and some, you see, not muscle, the tissues of the brain. So if you we see that, we know, okay, there is a problem here. Hmm? Rule out other cognitive declines. We rule out other cognitive declines. Now, in Alzheimer's disease, unfortunately, unfortunately, treatment, uh, no cure, no cure. Even if we can treat, unfortunately there is no cure, because when your brain is getting an atrophy, when your brain is getting small, we cannot boost it to be big. Your brain is really protected inside the skull, and there is something called blood brain barrier that protects any bacteria, anything to cross to the brain, because anything that crosses to your brain may bring it, no matter how minute it is, it may bring problems. You see, now we only do medication like cholesterol inhibitors, e.g. donepezil. They help boost the cognitive function. Receptor antagonists like NMDP, memetabine. If you have seen someone with dementia with a drug called memenatin, it is an NMDA receptor antagonist. It helps boost the what do I say? You see my hand. What I said, they are called dendrites, receiving end. It helps help in neurotransmitter releasing and even the communication. Supportive care, structured routine, safe measure. Alzheimer's, please always help these people to boost their memory, at least. You see, by cognitive stimulation, by asking them, training them, it helps cognitive stimulation. And then you attach them to occupational therapy, and you have a family and a caregiver. Hmm? We have said Alzheimer's disease causes abnormal deposit of amyloid plaque and tau in the brain. That is the cause of Alzheimer's disease. Abnormal deposit of amyloid. We call it amyloidosis. Abnormal plaque. Now we go to the other one, which is vascular dementia. Anytime you hear about vascular, what do you we have come from the main, which is Alzheimer's. If you have a question about Alzheimer's disease, you ask. But the main cause of Alzheimer's disease, before I go to vascular dementia, is abnormal deposit of what? Abnormal protein in the brain tissue, because of several mutations and factors and the genes that we have talked about. Yes, we have managed that. We have said, unfortunately, it has no treatment. Now, we go to the next one, which is vascular dementia. Vascular dementia is the second most type of dementia after Alzheimer's, the most common. It results from impaired blood flow to the brain. Hmm? When you talk, you hear anything about vascular, you remember vessels, blood vessels like veins, the lymphatic system, the arteries. You see, this one is often due to stroke, mini stroke. Mini strokes are, when you talk about mild strokes, you usually talk about transient ischemic attacks. You get it? An ischemic attack is whereby oxygen is not getting to your brain. Ischemia is lack of oxygen. So when I'm talking about transient ischemic attack, it is something that comes and goes. Mini stroke. Stroke is whereby your brain has no ability of getting oxygen and nutrition. So it stops to function normally because your brain now is not getting oxygen and nutrition. You see, now this is when we talk about vascular dementia, we are talking about vascularity, blood vessels. They have no capacity of carrying the oxygen and nutrition to your brain. Or chronic small blood vessels. In your brain, there are some small the small blood vessels inside there, and there is something called the circle of Willis that has blood vessels that delivers nutrition and oxygen. Key features. What are the features when we are talking about vascular dementia? Vascular dementia, vessel dementia, very simple. Vessels, arteries, veins. Only Mawira is here, man. Only Mawira, big up again. We are talking about dementia. Dementia, it's a very big word, but we have 9 types of dementia, and we have talked about Alzheimer's. Now we are talking about vascular dementia. Now, vascular dementia is, you have said vascularity are blood vessels. These vessels have no capacity to deliver oxygen and nutrients to your brain. Now, what are the features? Stepwise progression, step by step. Symptoms worsen sudden after each vascular event. You get a mini stroke, and then there is the symptom. Please, as you get in, please just press the like button, place it. If you have a question, ask. If you have an example and you want to share with us, share. Very soon I'm bringing people that are suffering these mental issues here, and you will see they are real. And those that have decided to speak about themselves. Yes. Now, we are seeing about the key features of vascular dementia. You have a person, listen, this person has been taking a lot of alcohol and living a sedentary lifestyle. And then you get blood uh, slow flow in your veins and arteries. So there is no oxygen and nutrients. What do you get? Stroke. Because some of your blood vessels are thin or they have been blocked. So stroke comes in. And after the stroke, what happens? You start being forgetful. You see, some part of your brain did not got oxygen and nutrients and it's dying off. Some cells are dying off. So you see, it was a stroke maybe, and then now you are having something because it started out as vascular thing and now you're having a stroke. And then you have, after that stroke, you start having problems with thinking and reasoning. Then what comes in? Slowed processing speed. You before you answer or you do something, you start processing things slowly before you do them. And at times you have difficulty in concentration and planning. You cannot plan yourself well. You want to go out in the morning in a meeting, you forget doing this, you cannot plan the next move. You see, memory may be less affected initially than in Alzheimer's. This is a vascular, because a part of your brain is dying off because of lack of oxygen and nutrients. So what happens in Alzheimer's? We saw the tau protein has taken over and you are forgetting totally. But here, memory is there because some of the cells in your brain, they are still working. and they are healthy, but some died off, and you got a stroke and you're coming out of the stroke. You see the difference between vascular and Alzheimer's. And then there is mood changes such as depression and apathy. Beauty in the house, my friend. Beauty, welcome. You're talking about Alzheimer's disease, and 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 we have talked about, we are talking about dementia. We are talking about dementia. We started with the broad dementia. We have gone to Alzheimer's. Now we are at vascular dementia. Yes, you see how these things are coming one by one, like one by one. I'm helping you to know how to diagnose these things. Now, mood changes. Why does mood change? Serotonin, the neurotransmitter that gives you cognitive function, and dopamine. Because now your brain is atrophying, the release of these neurotransmitters, it releases like this, comes out impaired. Hmm? And now you cannot have that mood, the good mood, the serotonin mood that comes in, the melatonin that gives you good mood, and excitement, it's out. So you start having depression. Dopamine is not there, it's being released so slow, and it cannot help you have those good. So the gait or balance in early stages, unlike issues unlike Alzheimer's, because now we are dealing with oxygen vessels that are impaired, and you got a stroke. So walking is a problem. You cannot walk well. The gait, how you walk, is disturbed, because remember, your brain gives you balance. Now, features, as you see, I pinpoint them, of dementia, of vascular dementia: stepwise progression rather than after stroke or so, problem solving with thinking, reasoning, slowed processing speed, difficulty with concentration and planning, memory may be less affected than in Alzheimer's. Mood changes, because now dopamine is released in a low capacity. Gait problems, walking is difficult, but in Alzheimer's, someone has good gait, can walk well. You see, causes, one of the cause of vascular dementia is stroke. Stroke, stroke, stroke. Please, when you are above 35 years of age, hit the gym. Don't live a sedentary lifestyle. You know, when people are at 35 years, that is where you are so working out, getting money, feeding your family, doing things so that everything can be okay. So when money comes in so much, what do? You are always out partying, drinking, doing A, B, C, D. Now you will get stroke after 2, 10 years. Don't. Stroke is a major factor when it comes to vascular dementia, I've explained. Chronic ischemia due to narrowing of the blood vessels. There is two terms that I'll explain here. Arteries narrow due to two things: arteriosclerosis and atherosclerosis. Atherosclerosis is sedimentation of something inside the blood vessels, causing the vein to be small. But arteriosclerosis is where the artery cannot relax or constrict. It is narrow and cannot constrict, relax anymore, be big. Those are two different things. So both of them can happen. Some people have this problem in their family where their vessels can be hard and cannot expand. You get it? So you come and check about it. No, cerebral small vessel disease. There are small vessels in the circle of Willis, the blood vessels in your brain, that sometimes they just get blocked. You see, and they cannot push blood. So your brain dies off. It's not getting oxygen, it dies off. Any condition that reduces or blocks blood supply to the brain. I've said atherosclerosis. Sedimentation can be blood clot, a blood clot. A blood clot is a very important issue when it comes to blood thinning. uh Cholesterols. Cholesterols can be one of them, and emboli. We call them emboli. And even sometimes you can have air blockage. You have had an accident or you have gone through an operation, and then when the let's say people that go get accidents and fracture, and then you're done a nail, when you go back to remove that nail, what happens? You get an air emboli. So air stops the blood from flowing normally to your brain. Cholesterol that sediment in your blood vessels inside, they get into your blood vessels and they make your blood thick or narrow the blood vessels because they are sedimenting. They will reduce the capacity of blood getting oxygen to your brain and nutrients. Arteriosclerosis. Arteriosclerosis is this: your vessels being small and have no capacity to expand and relax. So when they are small, they are reducing the chances of your blood going to the brain because there is a capacity of your vessel, the volume that can pass enough blood to your vein. Those are the causes of vascular dementia. Now, vascular dementia, when you hear anything about vascular, think about the blood vessels, the arteries, the veins, you see, the lymphatic system. We will one day do them. A studio is coming where I'll be explaining and you'll be seeing those things. Now, let's go to the risk factors. Who can get this vascular dementia, the dementia easily? People with hypertension, hypertensive, because high blood pressure can rupture your vessels and reduce the capacity of getting oxygen. Diabetes, high sugar levels attracting bacteria, you see, hmm, can make you have sediments in the blood and you can have that problem. Smoking, please people, smoking is everywhere. Smoking, when it brings cancers, it's not good. Please, let's not smoke. Smoke brings cancers. Smoke brings stroke. Smoke brings vascular dementia. Hmm? And most of the time, smoking is the cause of diabetes because of insulin resistance. Then other thing is high cholesterol levels, and then arterial fibrillation. Arterial fibrillation is the heart not beating well. Fibrillations. It is beating so high or low. It is having high beats or low beats. And when you're having high beats, you know what can happen. It can bring stroke. Previous stroke or heart diseases like rheumatic heart diseases, you see, those are problems. There are so many heart diseases like SAD. Those are the problems. Obesity and lack of physical exercise. That one we have not talked about. We will not talk about it because I've explained. Now, if you have a question about those, let me know. I know there are some people who are undergoing this dementia issue, and I may be of help by telling you what's the right thing to do because maybe where you are, I quit smoking 4 years ago now, and I'm a vegetarian for 30 years. I just eat a little fish sometimes. Big up Johnny B. That is the spirit. Smoking. Big up Johnny B. I applaud that move. Yeah, because Johnny B saw if I continue taking meat, maybe it will release more amino acids and I'll have more cholesterol. You see, maybe, but you see, more starch brings more cholesterol maybe on when it is you eat more starch, what happens? The excess ones are converted to some cholesterols. Big up Johnny B. That was a good move. Please help your brother or your sister or a friend to quit smoking. And you see, when you quit smoking, you are healthy. Yes, vegetarian. Vegetables are good. They are fiber. They make you stay away from stomach cancers. Now, how do we know this person have vascular dementia? History of stroke or vascular risk factors that I've talked about. Hypertension, if a person has hypertension and then this person starts to be forgetful, you look at what we have talked about. Cognitive testing that is done in hospital by us doctors, we know what to do. Brain imaging, you are taken to an MRI, we see if your brain has ruptures or aneurysms. Aneurysms are arteries that are big near rupture. Eh? Brain CT or MRI, which is showing an evidence of stroke. Hmm? Lady M is in the house. Lady M, big up to you, Lady M. Always a lady that bigs me up. I thank you every time for your support and everyone who is supporting the channel to grow and pass that message. Now, Ruta, we are talking about the diagnosis, how to find out a person has this. If you see in an MRI, some parts are died, or you know after a rupture, this is vascular diagnosis. Management, prevent further damage by controlling blood pressure. If your blood pressure is high, we have talked on how blood pressures are are prevented, lowering the blood pressure. This reminds me, there are so many people that are confused about blood pressure drugs. Because it's a matter that has come, there will be a day that I'll explain how those blood pressure drugs work and how you should take them. You see, because you go to a pharmacy, a doctor doesn't, some health workers don't know how to give blood pressure drugs because you are given a drug that cannot work on you of blood pressure, but you are taking them and your blood pressure is not coming down. Blood pressure is a very huge topic, and if you are given a drug that is not of the choice of the problem that you are having, my friend, your problem will not be solved. So I will talk about it one day. Now we continue. You prevent high blood pressure, sugar levels, and cholesterols. You see, cholesterols are coming in. Antiplatelets medications like aspirin, very important. If you are 35 years of age and above, and your doctor has not told you don't take aspirin, please take at least one aspirin tablet thrice in a week. They'll help you a lot when it comes to these problems. You see, they'll help you a lot when it comes to these problems. Now, we are having management. We are under management, and this is a very huge topic of management. Cognitive support and therapies. You will always go to have therapies to help you, how to you help yourself, how to know how to manage yourself. Yes, yes, give me 1 hour, please. Okay. Now we talk about treatment of symptoms like depression. You see, it's very important when a person is undergoing these things, you treat, because this is a person who is forgetful, and he's not understanding why he's forgetful. You get it? He's not understanding why this he is forgetful. So what do we do? You support with antidepressants for mood, medication to improve attention and memory loss. That is all about vascular dementia. Vascular dementia. Please, if you have a question, put it out. Put it out so that maybe you have a person, you saw this person doing A, B, C, D, and you're not understanding, and you went to a doctor, and a doctor told you that that is dementia, and now you don't understand what to do, and finding that doctor is hard. Just ask, email me. My email address is there. We see. Now we are going to the third one, which is Lewy body dementia. We have said we have 9 types of dementia. Lewy body dementia. I'll go faster because of time. What is Lewy body dementia? It is a progressive neurodegenerative. When you talk of neuro, think of the brain. And it's a second most common dementia. Again, most common. It is characterized by the presence of Lewy bodies, aggregate of proteins in your body, in the brain, affecting thinking, movement, behavior, and mood. Now you see, just as Alzheimer's, there is a protein called Lewy body. These are two closely related in Parkinson's also. Dementia with the Lewy body with Parkinson's are brother and sister. You see, dementia appears before or at the same time or as movement problems. When you start moving, you forget. You get it. And then the the other type of dementia, which is Parkinson's disease dementia, dementia develop after 1 year or more of establishment of Parkinson's. But Lewy body dementia appears before or at the time as movement problems start. When you just have movement problems, they start. You start forgetting. Cause, what is the cause of this? The cause of this is unknown, is really unknown, but it's associated with alpha-synuclein synuclein accumulation of the protein I've said in the brain. Shared pathologies with Alzheimer's and Parkinson's. So this one, I will not go to deep chemistry, but just know there are some proteins called Lewy bodies that are in the brain. They get deposited, and then you have problems with movement, and then you have problems with thinking. You get it? Lewy bodies are deposited in neurons, the neurons of the brain, cerebral cortex here, so that you are having cognitive issues of thinking and understanding. Yeah? And then there is a part called substantia grana. They are deposited there. You start having problems with movement. So this Lewy body dementia, if you see how someone has movement problems and forgetting problems, you know the cerebral cortex and substantia nigra is affected. Substantia nigra is where the brain helps in movement. You get it? So this is a problem called Lewy body dementia. It disrupts something called acetylcholine. It's a neurotransmitter in your body. That one is not in the brain. And also dopamine. Dopamine is in the brain. So clinical features are progressive dementia with attention, progressive dementia with attention. You get it? Progressive dementia with attention, and execution function deficit. You cannot execute something. Fluctuating cognition, visual hallucination, because now the frontal cortex is disturbed. You start having hallucinations. And remember, the dopamine is not there. So if dopamine is not there, what will happen? You will start having a problem with hallucination. Motor symptoms, you cannot move. Rigidity, sometimes you are rigid because there is a problem with the center of your brain that coordinates movement. You see, the place called substantia nigra that coordinates movement. You start having bradykinesia, tremors, you start having shuffling gait, you're walking like this, frequent falls. You get it? Psychiatric syndromes. Here is where you'll have visual hallucinations. You are seeing things, you are seeing people talking to you. You see it's dementia, but now you have started being like a psych. Depression and anxiety because you are not understanding what is happening to you. Sleep disturbance, you cannot sleep well. Excessive daytime sleepiness, you are always sleeping. Autonomic dysfunction, orthostatic hypotension, your blood pressure goes down. You see, there are so many people things that we are coming in this one. Lewy body affects movement because at substantia nigra on your brain that controls movement, there is a problem. At the frontal cortex where you have cognitive issues, it is affected. So if it is affected in the substantia nigra, you cannot move well. So your hypertension your blood pressure will go down. Urinary incontinence, you cannot urinate well. Constipation, even movement of food in your body is a problem. So here is whereby the diagnosis, how can you know? MRI, we check your brain. When we see you have visual hallucinations, we know this is that problem, and then you are exhibiting Parkinson issues. We see it. Now we go next because we treatment is like the same to others, but now here we have a psychiatric symptom. You only add quetiapine and clozapine, antipsychotic, typical psychotics with extreme caution. This one we give with extreme caution, but I'll not go deep to this treatment because this one is for the doctors. This one, the problem here can go up to 5 to 10 years. Patients eventually can recover with time. Patient can recover with time and a good treatment, because you see this is a problem that entails something that is being disturbed, but sometimes it can cause death. So we be careful, with this problem. Now we are going up to the ninth one, dementia. Now we are at the frontotemporal dimension. You see, when you're talking about frontotemporal dementia, this means front, cerebral cortex; temporal, this side. Frontal temporal dementia. What do we know about frontal temporal dementia? It's a progressive neuro disorder primarily affects the frontal and temporal lobes of the brain. Yes. So if it is affecting the frontal and temporal bones of the brain, what do you expect? You expect cognitive function to be down. The frontal helps us with cognitive. So we'll have behavior variants, behavior problems, affects personality, behavior, and social conduct. Progressive aphasia. You are not influent in grammar. You are making grammar mistake. Halt speeches. Comprehension of single halt is not there. Semantic variants. You have so many variants like fluent and empty speech. You are giving speech, but you cannot understand what you are giving. Difficult recognizing familiar faces and objects. So if you get an accident and you hit your face here and it protrudes, can have this problem. You get it? So causes and pathophysiology. The tau protein that we talked about, the protein that grows in your brain. This is in some genetic families, the tau protein, or sometimes trauma, because you can hit here, you can hit here. Trauma, genetic mutations. Some family have a genetic mutations of a protein called MAPT and GRT mutations. You see, they are very important. Now, what are the features? Features are like personality changes, impulsivity or apathy, hypermobility, lack of insight. You are binge eating. You are eating. We talked about binge eating. Language variant like progressive speech and language difficult. Memory and behavior losses. We have talked about it. Motor function, always your muscles are weak. Please, if you have a question, don't put it for yourself. Bring that question, we talk about the question. Muscle rigidity, gait, and all these disturbances are there. Diagnosis: MRI. You do an MRI. For the brain to look at what is happening. Now, when you have, this is the temporal side of your brain. This is the frontal part of your brain. So this is what I'm saying. Listen carefully. When you hit this place and it is destroyed, or the tau protein starts growing at your frontal brain, you will have a dementia, but you will be forgetful and you will be non-judgmental in front. Temporal, you will have problems with gait. You get it? You will have problems with gait because there is here at your brain inside, there is something that controls your movement. You see, so you'll have these problems, cognitive issues, thinking, making some mistakes always, judgment on what you are doing will be a problem here. Gait. If you hit, you have trauma, or the protein and gene mutation that we have talked about start growing in front or sideways. So if you have someone that is having problems cognitively, think about the frontal part. If it is gait and movement, temporal part. Okay, we continue. Management, always behavioral management. You'll give fluoxetine and antipsychotics because now it's producing hallucinations. Anything that a person is producing hallucination, those are positive signs of psychosis. You go to the video of psychosis, you will be good. Speech and language therapy, train so that this person can activate the centers of speech. Occupation and physical exercise help. Caregivers support is very important. Now we have another type, fifth type of dementia, which is called the fifth type of dementia, which is called mixed dementia. What is mixed dementia? When you hear about mixed, you know it is mixed of everything that we have talked. You have vascular and you have Alzheimer's. You have Alzheimer's disease and Lewy body dementia. The protein is there and Alzheimer's is there. Alzheimer's is there and frontal. You see, they are like three. Alzheimer's disease plus vascular that comes with Lewy body dementia. And then there is Alzheimer's plus Lewy body dementia. You see, there is Alzheimer's plus frontal temporal dementia. That is what we call mixed dementia. And when you go to a doctor, he sees signs of Alzheimer's plus Lewy body. He'll treat the Lewy body by giving you a drug that will reduce the tau protein that will not affect the brain. So those ones are left to specialists, so that if you have vascular dementia, you will be given some drugs to reduce your cholesterol, some antiplatelets like aspirin and clopidogrel that your blood to flow well, if stroke happens. So I will not go much into mixed because we have talked about Alzheimer's and Lewy body and vascular dementia. So when you hear, you go to a doctor and they write you have mixed dementia, think of dementia as Alzheimer's plus Lewy body, or Alzheimer's plus vascular which affects the blood, or the other one, frontotemporal plus Alzheimer's. So when a doctor tells you you have mixed, or tells a relative you have mixed dementia, ask that doctor which type of specific dementia of the three do I have. Now we have Parkinson's disease dementia. You see, Parkinson's, when you hear about Parkinson's, what comes to your mind? That is the sixth type of dementia that we have talked about. We have said we have 9 types of dementia. Parkinson's, one of the early popes died of Parkinson's. You know, the pope, I will not name the name here. The Parkinson's disease is a progressive that occurs in individuals with long-standing diagnosis of their Parkinson's disease. So it is part of the Lewy body spectrum diseases. Lewy body. So when we talk about Lewy body, you understand we are talking about the proteins. If you are coming in here right now, you are meeting Dr. Ben right now, you please like the video and share. And if you have a question, please ask. You may be helping someone who needs a lot, and you are here hiding with the question. Asking is getting experience. It's not bad. It's not even a stupid question that you think that is a stupid question. To me, is not stupid. It is very helpful to everyone. If you have anything that you can share to us, please share so that I can explain deeper in chemistry. Now, you see, we have been told Parkinson's is type of a Lewy body complication. Lewy body spectrum disorder. Mary Butler Britton. Wait, Mary is in the house. Welcome, Mary, to the platform. You're meeting Dr. Ben for the first time. Big up, Mary. We are talking about dementia, and you are at the fifth one, which is called Parkinson's disease dementia. Mary, welcome again. We love friends. And here we talk about medicine and good vibes because we're talking about the mental health. Good, 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 good. We continue. Now, because it is part of the Lewy body spectrum disorder, along with dementia with the Lewy body. What do we mean? Hmm? In Parkinson's disease dementia, motor symptoms like tremors and rigidity precede dementia by at least 1 year. You get it? But dementia with Lewy body, in Lewy body dementia, appears before or within 1 year. It appears before or within 1 year. So differentiate between Parkinson's disease dementia and dementia Lewy body and Lewy body dementia. You get it? So the first one precedes within sorry, it precedes dementia by at least 1 year. The other one before 1 year. So we continue to cause of this Parkinson's disease dementia. There are some three parts of the brain, the three parts of the brain. What are the three parts of the brain that we are talking about here? The three parts of the brain that are affected. One is substantia nigra. These are the parts of the brain that are affected. Substantia nigra, it affects, yes, Dorothy? No, it's our daughter. Yes. It affects the motor symptoms. When you hear about motor symptoms, think about movement, motor, muscles. So the part of brain, one affects the substantia nigra. It affects motor function. Then there is the cerebral cortex, cognitive functions. When I talk about cerebral cortex, cognitive function. Then there is limbic system. You remember the function of the brain when we were starting? Limbic system is about emotions, feeling good, being cared for. Yani, you understand emotions, family caring. You get it? Associated neurotransmitters are here, like dopamine, which is a pleasure, we have always said, and acetylcholine, which is in cognitive function. So, when I'm talking about Parkinson's disease dementia, I'm talking about something that may destroy the substantia nigra that affects movement, the muscles, cerebral cortex, anything that affects cognitive behavior, decline, and then limbic system that affects emotion. And then there is some some dopamine neurotransmitter being affected and acetylcholine. Now, who can be at risk of getting this? Because we always hear some people have a tendency of getting Parkinson's disease. Long duration of Parkinson's disease can cause you to get this protein in your brain called Lewy bodies in the brain. So you will have this dementia, forgetfulness, old age, advanced age. And then this mostly affects the male gender. So men, please have good nutritional guideline and eating habits. Avoid alcohol and smoking. Smoking for old men is a bad decision. It helps you to get to this Parkinson's. When you've had a Parkinson's, you are having that disease, you are being managed, you are being given levodopa, and it comes to a place whereby you are still smoking. You see, severe motor symptoms, severe muscle movement, and those are the risk factors. There are diseases like muscle dystrophy. There are some people who are diagnosed with muscle dystrophy that can get this. Hallucination, REM, sleep disorders. Sleep disorders. We talked about sleep disorders. If you have sleep disorders, if you have sleep disorders, please don't take it for granted. Visit a doctor. Please like the video as we go on. Like the videos as we go on. it may help us to get more people to understand what are the benefit from pumpkin seeds and okra. Pumpkin seeds and okra, nutrition wise. Johnny B, I'll come to that. And okra. Okra is a vegetable. The functions of vegetable. I'll come to that because that is now nutrition, and we will see how you can help yourself nutritionally to get to that. Put that. I've noted that. I will end with nutrition and I will answer you that. If I forget, please remind me. Now, if you have hallucinations, a form of psychosis in schizophrenia, and you should go to a doctor and tell the doctor that I'm having hallucinations because it may end up destroying your brain. Hmm? You get it. You get the right treatment. Yes, clinical features in this problem. We are dealing with Parkinson's dementia, resting tremors, slowness. When I'm talking about bradykinesia, I'm talking about slow movement, rigidity, shuffling gait. You are walking. I use chickpeas and callaloo with green bananas for iron. Very good, Johnny B. We will come to nutrition. Shuffling gait, postural instability, cognitive symptoms are always a problem. Slow thinking, visual spatial deficits, memory losses may be a very big problem here. Impaired attention and executive. You see, you are having impaired attention and executive function. Hmm? Planning and multitasking is a problem. You cannot multitask. So train yourself to multitask. You see, if you train yourself, Johnny B is giving us a lesson. Yes, on nutrition, we will come to that. Thank you, Johnny B. Now, if you train yourself to multitask, you are training your brain to release neurotransmitters. You get it? That is very important, and you're training your brain to be healthy. Neuropsychiatric symptoms of hallucination, delusions, depression, and anxiety and apathy are always there. Sleep disturbance. When you get sleep disturbances, please see a doctor. And when you are always, there are some people in daytime they are always sleepy. You get it? Please 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 see a doctor. See a doctor when you have these problems. Now, we investigations, CT scan is important. PET scans, those ones we have talked about and talked about and talked about, because all these complications, they share the same modes of clinical and medical uh, advice is important, and diagnosis, it depends with clinical, medical, and laboratory. Not forgetting, when you go to radiologists to do this, CT scans, X-rays, all those are very important. Now, we check out the other one. We check out the other one, the seventh one, Huntington's disease. People for sometimes they confuse Huntington's disease with with the other dementia, Parkinson's. Huntington's disease is another disease that is confused with Parkinson's dementia. It's a rare inherited progressive neurodegenerative disorder. Parkinson's can be acquired and also genetic, but Huntington's also dementia is genetic. It's acquired. It affects movement. When it is in Parkinson, we call it chorea, movement, chorea, cognitive decline, dementia, and psychiatric disturbance. So when you have Huntington diseases, you will have movement problem. Let me explain about what is chorea. Chorea is this. I'm here talking to you like, how was your ride? Good and expensive. And I really paid a lot of you see what I'm doing. I'm not aware of the movement with my turnings. Chorea. Choria, I'm not aware and I'm talking to you. When I ask you, what are you doing? You ask me what? That is what we call chorea. Chorea in Annington, the movement, the sudden movement. Hmm? You see, and then there is cognitive decline, you forget, and psychiatric disturbance. You start having problems psychologically and psychic. You see, now, Huntington disease is a rare inherited progressive neurodegenerative disease that causes a combination of movement, the chorea that you are not aware of, cognitive decline, and psychic disturbance. So what do we say here? Hmm? Psychiatric disturbance causes is a gene called HTT gene on chromosome 4. Those are, when you are in primary, you are learning about chromosomes. You remember chromosome 4, HTT. Yes, HTT. The mutation is a CAG, trinuclear repetation. It is an abnormal gene. So it's a bad mutated gene. You get it? It's a bad mutated gene. Hmm? Sorry, Dorothy? It's a bad mutated gene. Sorry, I need some water. I think my secretary will bring it to me. It's a bad mutated gene. Yeah? So normally you may have, yes, very good. Your daughter is, yeah. You see, Johnny B, you have someone else who is like you. Now, normally, less than 35 repeats in that. That is now total science. The doctors and the health workers and the gene specialists know when it has less than 35 repeats on the gene, there is a problem. You get it? Pathologic is more or equal to 36 repeats. If you have the 6 repeats of genes, the genes that they are like this in the DNA, you have a problem. So Huntington's disease is a problem of mutation of a gene. You see, pathophysiology of this, how does this come? Degeneration of a caucate nucleus and putamen, part of the basal ganglia. Now, when the gene has mutated in your brain, when you are growing, what happens? A part of the brain called the caucate nucleus and putamen in the basal ganglia does not function normal because it is the gene has mutated and you are producing something that is not normal. Yes, you get it. Now it atrophies, it becomes big because it is not normal now. The gene has mutated, especially in the frontal lobes. And now disruption of dopamine is has an imbalance. There are three: glutamic, GABA, and dopamine. These are neurotransmitters that help your brain function. It becomes bad. So what happens? This affects movement, cognition, and behavior. You see, because the genes of your brain have mutated, you are starting to have dementia. Onset between ages of 30 and 50, because I've said when you are born, the gene mutation comes out gradually. Early symptoms may be you are very irritable, poor concentration at mostly at the age of 20s, 25, 26, 27, 28. You are irritable, you are poor coordinating, and you are having depression. Please watch out when the people that come out at these ages of 20s are irritable, have poor concentration, and have depression. Diseases progression is very slow, but at early age you'll have a problem. Hmm? Disease is progressive and fatal, typically within 15 to 20 years. You see, that is a very long time. Yes. Yes, just give me a minute. A minute, I bring something. A minute. Yes, sorry about that. I'm back. We are talking about. Uh, thanks. I wanted to have a dummy where I will show you the brain, but it's being used in another department. So Let's continue. Next time I'll come up with that dummy so that you will know how that thing happens in the brain. It's being used in the department with some other people. Let's continue. Now, how that clinical features occur here. The chorea that I've said, sudden movement, is rapid, involuntary, and jerky. You start having, you see, Huntington's, because now you are not aware, but the place in your brain that is coordinating the movement is producing this jerky movement. And then there is muscle rigidity. Your muscles become rigid in later stage. Remember, we have said about 15 years. You get it? Hmm? Or when my mom was diagnosed with throat cancer, I went to her rescue with some healthy food and cured her. Very important, Johnny B. Please tell us which foods you used. Please tell us which foods you used, please. Cognitive, yes, we have said we are in Huntington's. Motor symptoms are chorea, muscle rigidity, dystonia, dystonia is the movement. Every time you are doing this, dysarthria and dysphagia, you have problems in swallowing. You have problems in swallowing and difficulty in walking. Those are motor functions. And then cognitive symptoms. Cognitive symptoms, and we have said, slowed thinking, memory, usually relative. You are having memory, but it's not really good memory. Impaired judgment and decision making, lack of insight. Psychiatric symptoms, you are always having depression, irritable, obsessive compulsion behavior, and psychosis. This is Huntington dementia. You get it? So, chorea and the other one, which is called dystonia. Chorea is movement like this always, and you are not aware. Dystonia, you'll find someone doing this. You see? You see that? Ever blessed travels, welcome to the platform. We are talking about dementia. Please like the video and we continue. As so those are the difference of dystonia and chorea, and most of these people that have this movement, they are not aware of them. So the diagnosis of this is motor, cognitive, clinical management, and medical management. And you look at the family history of mutation and the genetic. We do imagings like MRI, CT scan, PET scan, and we check the brain. We see if there is an abnormal protein, or because you have said the abnormal protein and the mutation causes that thing to grow, to atrophy. So what do? We look at if there is atrophy at the basal ganglia of the brain. We know, wow, this is called Huntington's dementia. And the movement too, because if something is growing in your brain at the basal ganglia, you will have this movement problems, gait problems, you cannot walk well, sometimes severe headaches, and sometimes cognitive functions, you get to forget. And that's why Huntington disease is brought as one type of dementia. You get it? Now, we go to full support, ever blessing. Thank you a lot for the make an uncle as a friend. Thank you so much. Thank you so much. We go to ever blessings. Thank you so much. We go to the eighth one. We still have one. We have Creutzfeldt Jacob's disease. Creutzfeldt Jacob disease. One type of dementia. Let's see. What is? Have you ever been told or heard? Have you ever heard about Creutzfeldt Jacob's disease? It's a progressive and fatal neurodegenerative caused by prions. Prions are folded proteins. Folded proteins that can trigger abnormal folding of proteins. You know, your brain is folded to increase the surface area of thinking and giving, you get it. But there are some folds that are called prions, misfolded. They have not folded well. I wish I got that dummy of the brain, but it's being used the other side. Tomorrow when I come, I'll be using those dummies. They are in the studio to show you the brain is folded like this. Hmm? But you will find there are some abnormal folds in your brain. Let's say if it is folded like this, you will find abnormal folds like this. So these are the prions, but the normal one should be like this. You see? So these ones I had, yes, Jamaican Hanko has heard about the prions. So prions are the cause of Creutzfeldt-Jacobs disease. So when you hear about that word, know that there is abnormal faults. If there is abnormal faults, what happens? Neurotransmitters are not okay, and even the folds themselves, they are spongy like holes. They have holes that form in the brain tissue. So imagine having holes in the brain tissue. Most of the neurotransmitters will not work. They will not be sent well. Your brain cognitive function will go down. You will hallucinate. Yeah? Causes and types are: one, sporadic, genetic, acquired, and sometimes you will at acquired, you will see it is not known. It is iatrogenic. Dura mater grafts, corneal transplants, or human-derived growth hormones here are not well known. Variant linked by eating beef infected with bovine spongiform encephalopathy. You are eating beef infected with bovine spongiform encephalopathy. Mad cows. In simple, that can be a very complicated term. But you see, mad cow disease, those cows that have died and then you just eat the meat without knowing the problem, you may get anthrax, you may get mad cow disease, and this mad cow disease will give you what? The spongiform protein that may go to your brain, and then it starts changing your brain into a product of the mad cow. So eat meat on a well maintained, public health officer monitored meat outlets. You get it? Because when you go to that place, it means that the public officer have come and checked the meat and passed it on a QC check. And every state, every country has a public health officer. Don't eat meat from random people. Even here in Africa, let me say my community, before you slaughter your cow, you have to bring in a public health officer to certify that meat. You see, so it is very important to be eating meat where it is important, because you may bring this mutation to your bloodline. Affects young individuals and has prominent psychiatric symptoms on early age. Now, you see, it has come up to eating meat can give you this problem. You see that Creutzfeldt-Jakob disease is a problem. Is classified under transmissible spongiform encephalitis and spongy-like holes. Encephalitis is a problem of infection of the brain. So if it is this is the only transferable problem of the brain, transmissible. Eh? You can transfer from someone to someone. So be careful. Eh? And we have said there are causes and types of it: sporadic, genetic, inherited, acquired by eating meat that is, you've had that disease of a mad cow, the mad cow disease. So if you've had a cow was mad and it has been slaughtered, encourage people not to eat it, because it may transfer this gene to people, and people will start giving birth to children with an immunity problem that has this of the brain. Pathophysiology, how does it come? Caused by abnormal prion protein of the brain, that what we have talked, resistant degeneration, accumulation in neurons, trigger neuron death and vocational. So when you eat that meat, maybe you are not born with the mutation, you are eating that meat, it goes, it start forming holes in your brain, it become, you start having resistance in the cells of the brain, you get brain death. Hmm? Brain, when you do an MRI on or a CT scan, widespread neuron loss, your brain is dead, it is going and going. And then you have spongiform, a brain that have holes because of that mad cow problem. Hmm? Acy- Cystic glycosis. A cystic glycosis, cyst is something that has uh, some liquid inside. You'll see some liquid forms that are scattered in your brain. So people, when we talk about eating things from a certified public health officer, let's not buy food, meat from outlets that we don't know. You see, it may end you up to get this problem and end you to get dementia. Hmm? So, classical symptoms of this, hmm, is memory loss, confusion and disorientation, intention and impaired judgment. That is rapid in this problem that we are saying, Creutzfeldt-Jacobs disease. It rapid, it occurs rapidly because you have eaten meat, it is spreading, and this, it has gone to your brain. Now your brain is getting holes and getting spongy like pieces, and it's dying. You see, myoclonus. You will get myoclonus, sudden involuntary muscle jerks like dystonia, and sometimes you have choria. Hmm? My host just connected to your channel. Full support from very thanks, ever blessing. Ever blessing, please like the video and share so that we can help people outside there. I'm so humbled to have you in this channel. We are brothers and sisters of Jamaican uncle and everyone who is here. Now, myoclonus, we have said dystonia and choria. Hmm? Startle myoclonus, ataxia and gait disturbance. You start having problems in walking, eh? Poor coordination and balance, eh? Visual disturbance. You cannot look well. You are seeing things twice. If I look at you, I'm seeing you are like two ever blessing. You are like two Marcia Thompsons. You see that? Hmm? The cortical blindness. At times you cannot see. Visual hallucination, because now your cognitive centers at the frontal lobes are disturbed. What do? You have double visions. Akinetic mutism. Patient is mute and immobile but awake. Kinetic, late stage, when it is at late stage. But there are some variants like painful dystocia, longer courses, it goes up to 12 to 24 months. Early psychic symptoms, anxiety, depression, and withdrawal. That one may come. You have seen about how to know you have these problems. Now, we go to the last one, which is not the last one. We have 10. 10. Now, the last one is normal pressure hydrocephalus. This one I'll go so faster. Time is getting out. Time is getting out. I have 30 minutes to go to see patients. You know, a doctor has to see patients and help people. But don't visit a doctor because you are sick. Visit a doctor to talk, to have a healthy brain. You see, a doctor is a friend. Don't let just we need friends. We need friends. Yes, we need friends. Well, don't just see me when you are sick. See me when you are happy, and you continue making good vibes. Now, this one is another form of dementia called normal pressure hydrocephalus. Normal pressure hydrocephalus is characterized by enlarged brain ventricles with normal cerebral spinal fluid and classical triad. Imagine a big brain with the normal cerebrospinal fluid and pressure. Cerebrospinal fluid is the fluid in the brain and spinal cord that makes it don't have not to get trauma and balance. At least it helps it not to you, your brain, not to be hit by the skull. And classical triad of this problem is you have a large brain, but you see your cerebrospinal die real things podcast. Hello Benjamin and the chat. Hey, the real thing podcast, welcome to the channel. We are talking about dementia. We are at the ninth type of dementia. Like and subscribe if you have not subscribed. Big up, and once again, big up all the time. Now here is, let me explain. If your brain is, if you have a big hmm, if you have a big brain, it should balance with the cerebrospinal fluid so that it can hold your brain well, not to be traumatized. Hmm? You see, and tension too. But now you have a big brain with normal CSF fluid, cerebrospinal fluid. What will happen? You will have gait disturbance. You will not walk well because the fluid is lower than what is it's expected. You will have urine incontinence and cognitive impairment, dementia, because you are disturbing the brain. And like most of dementia, you can this one, it is reversible. When you feel early age, it is reversible. You can impaired CSF is due to arachnoid granulation. You see, there are some cells that release this fluid, but it's not releasing them well. Hmm? It leads to vascular enlargement. The vessels are enlarged, but the CSF pressure is normal. You see, the enlarged ventricle compress surrounding the matter, affecting motor tract cognition. Now, causes, this one is not known. Most, it affects more than 60 years of people, 60 years in old age. Cause is unknown, but secondary occurs in arachnoid hemorrhage. If you hit your brain, there is bleeding from arachnoid space. It can affect. So trauma, always protect your head. So your brain is important. Traumatic brain injuries, meningitis, and you remember meningitis is one of the brain problems that affect so many people. It can affect young to old. If you have bacterial meningitis, if you have fungal meningitis, if you have viral meningitis. Sometimes people go for brain surgeries and it is not well done. You get meningitis and brain injuries. You may get this type of dementia. Most of it, like Huntington's disease, you will get gait disturbance. You cannot walk well. Urinary incontinence, you cannot micturate well. Micturating is going to the loo, urine, passing urine, cognitive impairment. Yes, yes, we have talked about all this, but the last one, as we end today's dementia related, we have alcohol related dementia. People that take alcohol. Tomorrow we will deal with managing and nutrition. I think time today is not on our side. Tomorrow we will deal with nutrition and how to manage dementia. So, how do alcohol come up with these problems? Hmm? How do alcohol come out with these problems, my friend? Dorothy, uko na mgonjwa? Oh, please go there. Sitaki hawa watoto wanisumbue. Mpaka nimalize. Now, how do alcohol cause? Please go in front. You see, alcohol comes in this way. It can be chronic and excessive use of it due to thiamine, vitamin B deficiency, the most severe and well-known cause of syndrome, which often follows Wernicke's encephalopathy. Wernicke's encephalopathy is brain disturbance. So, Wernicke's-Korsakoff syndrome, a two-stage neurologic disorder caused by thiamine deficiency. You are having a, you see, when you're taking alcohol, it damages vitamin B. So if it is damaging vitamin B, what will happen? If this thing is damaging the intake or the uptake of vitamin B, what will happen? Hmm? You will have confusion, ataxia, ophthalmologia, nystagmus or paralysis of the eyes. You see, vitamin B is related to good vision. Hmm? That is the one. Wernicke-Korsakoff syndrome. Alcohol. So if you are taking alcohol, be careful on the amount of alcohol you are taking, because thiamine, which is vitamin B, is being depleted. Hmm? If it is being depleted, you see, you'll have long-term brain damage and untreated Wernicke's. Features of severe memory. And before we start, because I see time is going, I'll explain well about alcohol and vitamin B deficiency, so that people know alcohol excessive taking is not well. So for now, just know alcohol related dementia destroys. This is an important topic, so I'll go through it, but tomorrow when I'm starting treatment, I'll expound on alcohol and how vitamin B is related. You see, so you just know Wernicke-Korsakoff syndrome, there are two types: Wernicke's encephalopathy and Wernicke's syndrome. Tomorrow I'll explain it in a wide range. And then we have causes and pathophysiology. We have mammillary bodies. Dorothy, okay, sorry. Here we have mammillary bodies, thalamus, frontal cortex, and hippocampus. Those are parts of the brain that are affected. And there is symptoms, cognitive symptoms, atrograde, retrograde. I think this is because time today has been not on our side, and let me stop on that. The ninth one, because it's a big topic and it needs very slow discussion, so so that you can understand how alcohol can lead you to dementia. Let me not go through it. Let me do it tomorrow in details before we do management. So this time, if anyone has a question as I log out, please put up your question. It may be important. Or if this is a personal and confident question, my email address is, let me pin my email address, is benjaokwesh@yahoo.com. You can directly mail me on that address. Today time has been on my side, and it's important we don't rush through things. It's important we do things slow by slow, so that people can be helped, because this information is important. It is helping someone out there, and that person maybe has not have a chance to be one-on-one with a doctor who can explain. So guys, we have 5 minutes to talk about question. Anyone who has a question, it's open, you can pin it. It's very important you can pin it so that we go through it. I'm seeing today some people have really come in and are supporting. Please continue supporting this channel. It's time we help each other by growing the channel. We are trying to help people with mental health issues to know how to work out their problems. Someone is looking this video on his or her phone and is feeling empowered. It is very important. It is very nice. You have someone that has no knowledge. You can help that person by looking at this and telling that person, hey, I know of someone who can help you. Share these videos, share the channel. Let's help everyone grow. I've said I'm going to bring people in this channel that will be talking about themselves, how their journeys of mental issues have been. and how they have helped themselves to come out of some problems. Please, if you have a question, I'm waiting, put it through, I will explain. But if that question is confident, you have my email address there, benjakoish@yahoo.com. Email on that address, I will give you directions. You see, it's very important to interact. I'm seeing there's no questions. I thank everyone that has come to this platform today and shared ideas. I thank, we have one of us called Johnny B. Good, who asked a question about some fruit and some seeds. Unfortunately, with the time has not allowed me to answer that, because I'm supposed to answer that on management and nutrition. So tomorrow we will learn on how to treat, manage, and the foods to eat to manage dementia, each type of dementia. You've seen we have different type of dementia with different issues and different how they are being brought. So they are differently treated. Tomorrow, so Johnny B, tomorrow your question will be answered about nutrition. And there are someone asked another question. I think I'll answer it tomorrow. And if there is no question, either I'm a new subscriber by Uncle. Uncle is always helping the channel. I give all the blessings to Uncle, Jamaican Uncle. Uncle is a good vibe person. Is a person who wants good for everyone. Open heart. We thank God for the Jamaican uncle. We thank God for people like him, because getting people like Jamaican uncle is rare. You see, everyone who is coming here is saying, I'm a new subscriber recommended by Jamaican uncle. Good information. We'll continue to watch and follow. We thank you, Ida Jack, to do that. Jamaican uncle, be blessed. Let people be helped. You too, you can spread the message. Spread this message to someone else. Let's hear, I was sent to this channel by ABCD and I've been helped. I heard your video, I followed, and I'm helping myself. You get it? Thank you for your good information. Jamaican uncle, blessings always. May God bless you always, wherever you are, and each supporter wherever you are. Mental health is an issue that really needs each one of us. You've seen when we started, we came to realize that psychosis is a problem that can be managed. And not everything is psychosis. Even mood disturbance is not psychosis. So please, let's help each other. Let's grow together. Be blessed. I see there is no question on board. Be blessed, people. Always be cool. Wherever you are, I thank everyone. Let's meet tomorrow for the questions and judgment. Good time.